What this is, it is a subscription-based direct primary care. So for $125 a month, you can sign up, be seen by a doctor 3 times a month, whereas typically if you get into insurance or you don't have insurance, you're paying anywhere between, on average, $600 to $800 a month. And then you have co-pays, and then you have high deductibles, and most people won't go to see a doctor because of this.
Yeah.
Or they go without insurance, so they don't take care of their health. But with this subscription based at $125, it's very reasonable. And you can do telehealth or in person. Our brick and mortar is off of Lafayette next to Spotswood Baptist Church. And we are very excited to bring this to the community.
For individuals, this gives you options.
It does. It opens the doors. It definitely does for health insurance. That we're not health insurance, so we're only primary care. Nothing is going to be of, if you have anything as small as, let's say, sleep apnea, or something as large as, say, cancer, of course you need to see a specialist.
Sure.
And we're not going to do that. We're going to be here to help you with your everyday. I have strep throat, I have the flu, COVID testings, different things like that. So this is your making sure you stay on top of your health.
We did the market research, and I mean, amazingly, in Stafford, Fredericksburg, and Spotsylvania, there are nearly 45,000 people without insurance. So when you're out and about, you might think, well, who doesn't have insurance if you take that thought? And you'd be amazed. I mean, there's so many professionals, all the way down to anybody in the community, but 45,000 people don't have medical insurance right now. And so some of them don't qualify for services that might be free to them in the community. So this would be an option for them to have medical care without having to pay for insurance.
And you often don't think that. You just assume that if so-and-so has a job, they've got insurance.
Yeah, for me, I mean, there were years in the community where I was a pastor, and you would never know. I mean, there's tons of pastors, there's realtors, there's a lot of folks in the community who just don't have medical insurance. So again, this is a wonderful opportunity to have medical care without having to pay for medical insurance.
So I've been here for the last 5 years, and in this country for 17 years. I think the real America lives in the towns like Fredericksburg, and in their day-to-day life, they go to job, do their daily living, and work day every day, and not have to worry about how much is my insurance going to be, if my job provides me the employment benefits, and how much my bill is going to be for simple things like I'm having pain or sore throat or having fever. I can see patients waiting for months just to get an appointment. So I thought there must be a way to solve these problems. And then I found this direct primary care as a solution. And instead of going just by myself, I was really hoping that we can involve the community, and that's why you see Sierra and Gordon in the practice. It's really not nonprofit, but something for the community, by the community, where the service needed and the service is provided.
Fredericksburg, Spotsylvania, Stafford, and we have incredible hospitals, we have incredible medical practitioners, and it's also, we're technologically driven. So here we wanted to create an opportunity for top-notch medical care. I wanted to give the opportunity for telehealth so that people can be taken care of at home if they need. It just fits the way Fredericksburg, Spotsylvania, and Stafford have approached healthcare technology. It's bringing together the best of what our community has offered in a convenient way for people to get their primary care needs met.
I think this was not available in the past, but the state of Virginia allowed to have direct primary care since 2017. And that gave a new opportunity for the physicians also to provide this kind of service. I think that's a good step from the legislative side, and I think we should have more and more these practices for the communities.
Around the state and across the country, I mean, it makes sense. I mean, coming out of COVID, there was so much more telehealth. And it makes sense that now with primary care, if you need to see your primary care physician, you can be seen from home. And of course, we do have a physical location. You can come in here. But this model has grown immensely in the last 2 or 3 years across the country, but specifically here in Virginia.
You excited to have it in this region?
I am. There was a period of time in my life where I was paying for insurance. And it was so exorbitant. And then there were times I didn't have any insurance. So now offering this opportunity, and my job here is marketing to get that word out here so that folks know that this is an option when they have found their medical expenses each month just being too high.
So we're really excited about joining FAR, the Chamber, and FABA, which is all very community driven, as well as there's a speaking of just myself being a real estate agent in the area, we don't have insurance opportunities. We don't have group that we can get like discounts. So to have something like this and know how much this is going to touch the community and really help people out at such a reasonable fee. I mean, it's a cell phone bill or a gym membership fee, basically. It's really something that we are striving to help our community and help it grow.